All right, welcome everyone to our July Community Engagement Forum. I'm going to go ahead and get us started. I see people are still filtering in, and we have a lot to talk about today. So I'm going to go ahead and get us started. Um, I'm gonna follow our slides where they are, Jen, I think. So first I'll introduce everybody to our community engagement forum. I'm Sarah Brewer and I am our co-director for training, education, and mentorship at Accords. And Accords is our Adult and Child Center for Outcomes Research and Delivery Science, which is a big mouthful. Basically, we are a one-stop shop for pragmatic research. So we do a lot of work with folks across campus to help support pragmatic health services research in several different ways. Um, and we partner really closely with CCTSI's Community Engagement Core to put on this forum. If we pop forward, Jen, I'll highlight, we have a couple of events coming up. One that I want to highlight today is our Health Services Research Day, which will be September 23rd. And we have several other things coming up this fall that you can find on our Accords website. What do we have next? Oh, let's skip this one. We'll come back to that one. I have to in the middle of our rotating slides. All right. Um, so we want to we'll go backwards, it looks like. Um, uh, if you are interested in any of our former community engagement forums, we do post those on our YouTube page. That link is there, and Jen just put it in the chat. And we have several other announcements from the community engagement core today. So Jen, if we just want to keep clicking backwards in the slide deck, we'll just do them in reverse order today. All right. The community immersion training program is currently in progress for 2026, and you can expect applications for the 2027 program coming in February. Again, that link will go in the chat. CCTSI has a pilot grant program for community engagement, and you should be watching for the 2026 RFA release in November. And Kaylee would very much appreciate if any of you feel qualified to be a grant reviewer if you reach out to her. Um, CCTSI also offers community engagement consultations, and you can request those through Mary Fisher and get more information on the link there for community programs. Maybe we'll go back one more so I can frame. Our community engagement forum has been going for almost 7 years now. We're coming up on our 7-year anniversary. And I think just really amazing. We've been able to host 29 forums focused on community engagement topics with over 1,600 attendees coming to learn and network with each other. And these have been hosted, like I said, by Accords and then our CCTSI Community Engagement Core. And a little bit about them on this next slide. Sorry, Jen, we're doing gymnastics. We'll have to figure out how to land on the right slide next time. So our CCTSI Community Engagement Core really focuses on creating partnership, the PACT Council, which is the Partnership for Academicians and Communities for Translation. And they focus on transforming health research to balance power and responsibility between community clinicians and researchers to improve the health of people in Colorado. And this forum is one of the ways that we support other researchers on campus in achieving this mission. I am going to hand over, after all of those announcements and upcoming events, to Don to introduce our speaker for today, who's going to kick off our series for the 26-27 year, focused on diving deeper into the foundations of community engaged research. We're really excited about this because we've covered foundations 2 years ago as sort of our theme for the year. And this year, we're really excited to go a little deeper on some of the skill building and methods that people might use to really focus their community engaged research and exemplify some of those foundations in this work. Don, I'll hand over to you.
All right. Thanks, Sarah. Hi, everybody. Great to see you all here today on a warm summer's day. At least it is here in the Denver area. For folks that are joining from outside our local area. Uh, yeah, I'm the director of community engagement at CCTSI. And as Sarah mentioned, we're about to hit 7 years on this great partnership with Sarah and the folks at Accords for our community engagement forum. I'm especially excited today to introduce our presenter, who's Dr. Matt DeCamp. Matt is my associate director here of community engagement. Just took on that role this February, and it's been great to have him join our team. Matt is a professor. Who's housed in the Center for Bioethics and Humanities and also the Division of General Internal Medicine. He describes himself as a practicing internist, social scientist, and philosopher. I told him earlier today that I aspire to be a philosopher, but I just don't have the letters behind my name. But Matt's area of research and expertise is really looking at problems at the interface of healthcare policy and bioethics. And Matt has a wealth of experience in engagement and working in community, and really looking forward to your comments for us today, Matt. And I'm sure it will stimulate a lot of conversation and questions. I will encourage folks to put those into the chat as Matt's talking, and we'll try to take those as they come up.
Well, thanks, Don, for that introduction. I sometimes actually say that internist, social scientist, and a philosopher moniker starts like a bad joke or something. You put those three things together, but I appreciate the intro, and I've certainly appreciated serving as associate director of community engagement since February 1. I still feel like I'm learning a ton. It's been a lot, and I want to acknowledge that I've worked with many of the people that I see on this call, and both in some of the things that I'll present today and also just in community engagement in general. And I'm really grateful for all of your support and help through this. Today, I'm going to talk about methodological decisions for engagement in real world settings. I sometimes tell people that I both do community engaged research. I've had the good fortune of working with partnerships both in Baltimore, where I was previously, and here in Colorado. But I also do research that studies it and tries to find ways to make it better. And today I'm going to be focused much more on that side of the research on engagement in ways that I think could make it better. I by no means will be able to answer all questions about choosing methods for engagement during a presentation like this today over the next half an hour or so. Definitely invite questions. We'll leave time for discussion to follow. So I really hoped that I can start this conversation and give you all a few resources as well. No financial conflicts related to the content of this presentation. You can see here that I do have some funded research projects. And I'll talk about one of those, the Patient-Centered Outcomes Research Institute one, a little bit more towards the end. I really hope that by the end of this presentation, you'll be able to start, as I said, comparing and contrasting what makes an engagement method a good fit for specific community and research contexts, and also be able to describe some resources that are available to you to help choose engagement methods. That's a little bit more of the how-to part of this presentation. This is the translational science spectrum, and you can see starting at the right side, it moves in a cyclical fashion, really, from basic research, preclinical research, clinical research like clinical trials, implementation, all the way to public health. I think that we often think of engagement on this left side, where community engaged research can help support things like clinical trial study design, recruitment of participants, retention of participants, dissemination of results, implementation, and so on. I do like to remind us that really for more than a decade, NIH and others have encouraged community engaged research even at those earlier upstream stages. We don't often think about community engagement at the basic science stage, although I know there are some people on campus who do. And I'll put a shameless plug in that we have some of them presenting at our community engagement research ethics conference coming up in the fall, where we have a few researchers who are trying to figure out what it means to engage participants at that early stage of basic science research. When we think about the translational spectrum, I think this next question comes to mind, which is what engagement method works best at different stages of this scientific paradigm? Should we imagine that the same engagement method could be used for every one of these phases? Or do engagement methods look different depending on which phase of research we're in? And here's a take-home point. Many of you are probably familiar with this quote, which is variably attributed, although near as I can tell, this is the first attribution to Abraham Maslow. This is sometimes called the law of the instrument. I suppose it is tempting, if the only tool you have is a hammer, to treat everything as if it were a nail. And this is a take-home point because I hope that one take-home message from this presentation that you'll take is the idea that we have lots of different engagement methods. There's no one method to rule them all. There's no one engagement method that's perfect for every single circumstance, even if oftentimes we might have our own favorite methods that work for us well in some contexts and not others. So keep this in mind, and I'll highlight it throughout the presentation as well. So again, in community engaged research, I think we should continually seek to expand our repertoire of engagement methods, find new ones, find new ways of engaging, and so on. What is community engagement? What is community engaged research? This is a recent updated definition from the CDC just in 2025, their third edition of Principles of Engagement. You can see they write that community engagement builds sustainable relationships through trust and collaboration, strengthening community well-being. The process should be enduring, equitable, and culturally sensitive to all participants with a shared goal of addressing the concerns of the community. So a very high level definition of engagement. Now, many of you have probably heard of community-based participatory research, or CBPR. You might wonder, well, what's the difference between community-engaged research and CBPR? Are they the same thing? How do they relate to each other? As I say on this slide, we sometimes consider CBPR to be the gold standard, but it's important to remember that CBPR is really a specific approach to engagement. It's one that's deep, continuous, and truly driven by community, whereas I see community engaged research as a little bit more of a spectrum that maybe engages communities at those various stages of the translational process while still doing so in ways that are meaningful and authentic. And this little Venn diagram at the left kind of shows you how some conceive of the relationship between community engaged research and CBPR. That is to say that all CBPR is community engaged research, but not all community engaged research is CBPR. So a hint of the relationship here. Now, each of these are governed by principles. On this slide, I've purposely blinded you to which table represents CBPR principles and which table represents community engaged research principles. If we look just at the left, I'll read these and I'll ask you to think in your own head, is this CBPR that's being described, or is this community engaged research? Communities as the unit, not just individuals. Build on existing community strengths. Facilitating collaborative, empowering partnerships to address disparities. A commitment to co-learning. Balancing research aims to ensure mutual benefit. Focusing on issues of community concern. It's a cyclical, iterative process, delivering results to all, sorry, that should say all, and there's an emphasis on sustainable long-term partnerships. At some point you might look at the table on the right. what I've just described are considered the foundational principles of CBPR. And if you look on the right table, which are principles of community engaged research from that CDC, you can actually see a lot of commonalities reflective of that Venn diagram I just showed, being clear about purposes, communities and individuals with the right to make decisions, mobilizing community strengths clearly shared by the two approaches. So without going into much more detail, and I suspect some of you may have thoughts and questions about the relationship between community engaged research and CBPR that we can take on in the discussion, it's just to say that I see a lot of similarities in these two approaches, right? They both focus on building on community strengths. You can see emphasis on relationships and trust as key to both, and also an emphasis on sharing control, that researchers and community share control to some degree over the research enterprise. And my take on this, again, happy for discussion afterwards, is that is this really just a matter of degree and not kind between CBPR and community engaged research? A question to think about. Now, I think many of us consider, rightly so, CBPR as an ideal. Some might say even a gold standard. It is important to remember that there are certain reasons why CBPR might not always be the best fit for research. That can include research that's on a short timeline with a limited engagement budget or a lack of that flexibility for local adaptation or community control. It could be research where the question has already been determined by the funder. If you look back at those CBPR principles, right, the issue of concern is supposed to be defined by community. If that condition is not met, maybe CBPR is not the best approach. Or if there's a lack of willingness or ability to share power and control with the community more generally. So a few situations or circumstances in which CBPR might not be the best fit, but still, I think community engaged research, when done authentically, can greatly improve research design, conduct, and dissemination, even if it doesn't fully fit the model of CBPR. Now, I promised that today would be a presentation that helps us think about methods and research engagement methods. In prior work here at the university, funded by the Data Science to Patient Value Initiative and involving a number of people on this call, we developed a tool. I'm going to introduce you to this tool in a moment. But as part of the tool, we made sure that we distinguished between what we called approaches to engagement, methods of engagement, and tools of engagement. And so approaches to engagement are those organizing frameworks that set high-level approaches to engagement. And CBPR, I would say, is one such example of a high-level approach. Methods we considered to be a set of tools and techniques, formalized, sometimes protocolized, that together help achieve the purposes of that approach. So examples here might include stakeholder advisory panels, boot camp translation, community engagement studios, and many more that I'll show you. Those are different in my mind than tools of engagement because tools are a means for information gathering, creation, or sharing that's really used as part of a method. They're not themselves engagement, and I would put into this category things like simple surveys, interviews, focus groups, and so on. Those are often tools we use in engagement method, but they're not themselves engagement. Now, I acknowledge that there are fuzzy boundaries between these categories, and we could again discuss where they might fall, but I still think they're important. So fuzzy boundaries, but important boundaries to keep in mind as we start to enter into this conversation about engagement methods. So we might ask ourselves this starting question, and throughout the rest of the presentation, I'm going to have 3 questions for us to think about and start giving an answer to, or at least a framework for an answer. So we might ask this question, are some engagement methods better for some of those research stages over others? And here again, we remember the hammer and the nail. One of the things I've observed reviewing grant proposals and research over time is that a standard approach for whatever the research is to create a stakeholder advisory panel to advise on the research, a very important time-tested engagement method, but is it always the best method for the research that you're engaged in? So let's unpack this question. And to do so, I want you to imagine the following case study. Dr. Elena Ramirez, a public health researcher, is launching a new initiative focused on improving chronic disease outcomes in a rural region. While existing literature highlights common risk factors, Dr. Ramirez recognizes that national data may not reflect the experiences and most pressing concerns of the local community. To ensure her research is relevant and impactful, she wants to engage the community, and I think we'd applaud this. But how should she? She might think about that stakeholder advisory panel. She could reach out to her existing panel if she has one from a prior hypertension study, whose membership includes several community organization leaders to help her answer this question. She could use another method I've already mentioned, a community engagement studio. CE studios could bring together community experts, moderated by a neutral facilitator, to come to consensus about what those priorities and pressing concerns might be. Or she might engage in deliberative polling and follow on town hall events. She could conduct a community-wide survey, followed by one or more in-person community meetings that could solicit priorities from a broader community. I hope you're already getting the sense that these three methods are pretty different, and each of them has relative advantages and disadvantages relative to her question about which concerns, which priorities matter most. When we dig in to these different methods, and this is by no means a comprehensive approach to these three methods, you can start to see how they differ from each other. That stakeholder advisory panel has certain advantages. There are already people that are known to Dr. Ramirez, and it appears to have influential community-based organizations as members of the committee. On the other hand, the composition may overly influence certain priorities. I mentioned that that prior panel was focused on hypertension. And given that, how well is the panel able to think beyond hypertension as the chronic disease priority? Community engagement studios have the relative advantage of being highly structured, well researched. This is a very well-known engagement method in the literature started by folks at Vanderbilt. It's highly structured, it's replicable. The community is the expert in this approach, but some people see disadvantages in engagement method. Dr. Ramirez gets a wider segment of the community voice using surveys. Disadvantages exist for this method too, though. Doing those surveys and community meetings may be more expensive than some of the other methods. And there's an assumption lurking in survey-based methodology, right? And that assumption is that the majority opinion matters most when we're thinking about priorities. And that may or may not be the case depending on the research question and the context. So giving you a sense of how those three different methods look, I now want to give you a little bit of a tool that we've developed to help researchers and others explore different engagement methods. This is the one I hinted at earlier. It's called dicemethods.org. And we developed this particular tool to help researchers consider the fit of a method to the purpose of the research along three basic organizing concepts: planning research, implementing research, and disseminating research. And if you go to dicemethods.org, you can play around on this tool and see what it does. It's sort of fun to play with. When you think about planning research methods, you might suggest that the method needs to be tailored to setting priorities in a way that we consider legitimate. And by legitimate, I mean, are these priorities true to the community? Implementing, you might think of differently. If you're implementing a research study, research recruitment, research consent, and so on. Here, I think you really want a method that's tailored to understanding the perspective of those who might participate in the research. You need something a bit more focused than that deliberative town hall event. And when it comes to disseminating research, here I think you want a method that's more tailored to reaching the broadest swath of those affected. So from a zoomed in perspective on something like a stakeholder advisory panel to a zoomed out perspective when it comes to disseminating or implementing research findings, a simple organizing framework, and again, a tool that you can use. In fact, when we look more closely at this tool, I've been focused on that stage of research, right? Is it early stage, middle stage, late stage? But in fact, the tool, if you're interested in it, allows you to play around with lots of different dimensions to see how engagement methods line up. You can see slider bars in the middle of this picture that include things like budget, things like time, and things like the number of interactions you might imagine having with community over time, allowing you to see which methods fit best for particular circumstances. Now, I'll say at the outset, this doesn't tend to be an all or none deciding tool. When you play around with these slider bars, what actually happens is particular engagement methods get a little bigger or they get a little smaller to say that it's maybe a little better fit or maybe not so great of a fit, just to help brainstorm through what methods you might use for a particular purpose. I'd encourage you to check out DICE methods. Now I want to move to a second question. We talked about methods and stage of research, but a second dimension of this is engagement methods and their fit to specific community contexts. How do we think about answering that question? And here I do want to introduce a research study of our own in a couple slides. But back to that hammer and that reminder, framing reminder for our presentation. When you have a hammer, everything looks like a nail. I'm really good at method X, so I can use it no matter which community I engage with. This might be tempting in that law of the instrument, but should this be our approach? So we're in the middle. Bethany Kwan is the contact PI of this study, and I'm dual PI. Others on the call here are on the study. Sarah Don has helped, and others. We're in the middle of a CHEER study. This is a multi-year study that's working with 6 different community academic partnerships. You can see them listed on the left. The study has 3 primary goals. One is to characterize the core features of engagement methods in even more detail than I've shared today. A second goal is to assess the fit of engagement methods for planning patient-centered research within these 6 specific communities. And lastly, we're in the middle right now of conducting a comparative effectiveness study to see which methods work best when. We have this very complicated study where each team is using 3 methods for the same purpose over time, and we're collecting data to compare how well they do in each community context. More to come on that. We don't have those results yet. Today, I want to focus on this middle step, which is how do we assess the fit of methods within specific communities and share with you some of the findings, what we've heard, and lessons learned from this stage of the project. So one of the things we did in this study is we asked each team to rank from 1 through 12, that is from most to least preferred, 12 methods that were adapted from that dicemethods.org tool. Then we held a 90-minute focus group with each to learn why they preferred certain methods over others when they were engaged in this partnership in planning research. On the right here, you just see the ranking top to bottom, most preferred to least preferred, aggregated for all 6 of those teams. You can see that appreciative inquiry is a method that's at the top. Community engagement studios also at the top. Things like citizen juries or that deliberative polling I mentioned earlier falling near the bottom. Interesting in terms of the ranking, some of the differences that we're seeing. I want to share with you just a couple of the lessons we've learned from those 90-minute focus groups, those discussions. I'd say that across all the community focus groups we held with each of the 6 teams, 3 themes came up in relation to preferred engagement methods that were common to all 6. One, reflecting those community engagement principles, a desire for methods that promote trust between community and researchers. Second, ensuring that methods really do address community-specific needs. And third, using methods that really explicitly result in tangible benefits to the community, that is, tangible outcomes. Everyone, all 6, were very interested in those 3 aspects of engagement methods. So a lot of commonality, even though if you go back to that slide, the teams were very different health conditions, very different community contexts, and so on. A second lesson was an interesting one to us that we learned is that words matter, meaning actually how we call engagement methods turns out to matter in ways that kind of pull in lots of different directions. So several of our community groups reacted to the words we used in describing the methods. If you go back to that list, there's a method called a citizen jury. And one of the focus groups very clearly disliked citizen juries, not necessarily because of the details of the method, but also or primarily because of the legal connotation. And this part is true to the method, the sense of an adversarial methodology, that this is a methodology that sets up 2 sides that have to fight each other in court, as one would say. And this particular group said, that's not a good fit for us. We don't like the legal connotation. We don't like the adversary. Boot camp translation is one that I point out just because people had lots of different and sometimes conflicting opinions about it. Some perceived a military connotation to boot camp that they didn't like, but others reminded them of their exercise classes, sorry, not glasses, classes, and almost a get to work approach. So a different reflection on the way words matter and the way we call research methods and how they're designed. A really important reminder, I think, for us on the research side, perhaps about jargon, but maybe also something deeper. Another important lesson that I also think reflects those engagement principles is that strength-based approaches were preferred. Several of our communities describe themselves as being often treated as really having deficits, things like disability, cognitive impairment, and so on. And so for these communities, they specifically looked for methods that overtly emphasize strength-based approaches. And one of those, lo and behold, going back to that list of the top 12, the number one preferred across communities was appreciative inquiry. And this is a method that I would say uniquely focuses on community strengths rather than weaknesses. Not surprising to see communities who've experienced that deficit mindset toward them wanting an engagement method that's a big strength mindset. Another important lesson for choosing methods. So when selecting engagement methods, I do think it's just critical for us to choose methods that are sensitive to the context of the community with which you're engaging. I've highlighted a couple features of that here, but as you can imagine, this is going to be highly context community specific and requires a lot of deep thought when we think about it. I like to close this section or with this particular quote because one of our focus group participants implored us to find or design new methods, asking that question, why do we only have those 12? Design a method in community by community for future community engaged research. And they describe the current status quo as it's like taking an engagement method created on Mars and using it on Earth. Why aren't we coming up with new engagement methods? Maybe that's part of the future. I'd love to think about that, what that looks like. I want to move and close with just a couple slides on a third question. How should I decide whom to engage in community engaged research? We talked about stage of research. We talked about community fit. What about whom to engage in community engaged research? Here again's that hammer. The standard approach is to invite people who look like those affected by or interested in research. But is it so simple? Years ago, we did a study of patient and family advisory councils, like a stakeholder advisory panel. We held 5 focus groups to learn what patients, caregivers, and families thought about this question of who should be engaged on a council. And in fact, what we heard really expanded our view of the who question. And I hinted about bringing up some philosophy today, and this is a place where our findings intersected political theory. Political theories about representation, which emphasizes or describes at least 4 different approaches to the who question: descriptive, formal, symbolic, and substantive. In the middle, I have the description of each. Demographic similarity, that's the looks like me. Authorized, that is elected, that is chosen by me. Accepted by those that are represented, that is endorsed by me. Or lastly, an approach that says what matters is, does the person represent my interests? Can they advance my goals? Now, I think you'll already sense that these 4 are different. They each highlight different approaches to the who question. And again, depending on what we're doing and what our engagement is, we might think about when it matters to emphasize more of one of these than the other. In that study, the broader community represented by the council cared about this who question in part because they cared about the what question. That is, what would be done as a result of the council's work? And that was affected by the who question. And I think you see it in this particular quote where one of our participants said, there's an interaction between who sits on the board and what kind of issues the board deals with. I think there's an interaction between the two, and one affects the other. Who matters because it matters what and the impact that a group can have. So again, we have these 4 approaches. We have the looks like me, the advances my interests, the chosen by me, and the endorsed by me. 4 different approaches to the who question of engagement. Ideally, obviously, we could find this sweet spot in the center and get all of that in one, but we might not always be able to. And here again, I think we have trade-offs around deciding who to engage, within what context, at what stage of the research, thinking about that in a deep way. So I'm right at time here, and just to offer a couple preliminary conclusions and open for discussion. Remember the hammer. There's no one size fits all to engagement methods in community engaged research. I would posit that choosing an engagement method for community engaged research requires just as much thought, maybe more, as choosing other research methods. We spend a lot of time in research talking about research methods. I think in community engagement methods deserve just as much time and attention in planning a research project. Fortunately, I hope I've also been able to suggest today that the science of engagement through research done on engagement itself is progressing, and we now have resources to help us decide and wrestle with some of these questions about engagement methods. DiceMethods.org is one. I think soon there will be numerous others. The Patient-Centered Outcomes Research Institute is funding a lot of research on this topic now, and probably 3 years from now, we'll be at a completely different place for a presentation just like this one. Thanks for your time. I look forward to Q&A to follow.
Thank you, Matt. I'm going to start with a question we got in the chat. And then I see some hands up as well. But Kate asked if you could say a little bit more about appreciative inquiry, what it is, but also maybe how you've used it or some examples of that particular method.
Oh, that's a good question. I've not personally used that method, but our cheer teams have, and I know that we have cheer team representation on the forum today. So if anyone would like to unmute and describe firsthand experiences with that method, that would be great. If you look back, well, number one, if you're interested in the method and you want to learn more, I encourage you to go to dicemethods.org, where there are handouts that describe each of the methods. Appreciative inquiry is a multi-stage method that's, Sarah, you'll have to help me out. It's characterized by 5 Ds: define, discover, dream, design, and destiny phases. There are 5 phases of it, from interviews, it actually starts with an interview portion, moves into design, group design type portions, and then creates next steps forward. But the framing of it is all around strengths of the community.
I see that.
As I said that reson I'll say one other thing. As I said, that resonates with many community contexts, but I'd also say that in some of our focus groups, we actually heard some concern that overly focusing on strengths might limit possibilities for problems that need to actually be solved in the moment. So no, I'm not, just to say that I'm not suggesting that AI or appreciative inquiry solves all of our problems. Sarah, you were going to add.
I was going to say that Bethany just popped in the chat to say she's happy to add. So, Bethany, anything you would add to that description or personal experience that you might want to share?
Yeah, it was a great description. I mean, it really is a tremendously fun and engaging method. It has a particular focus on developing programs or interventions. I would say it wasn't like we didn't use it for kind of picking study design features. I think you probably could, but I think it's
Hmm.
best for that type of design work. And then one of the other things that I really appreciated about that method is that in the destiny phase at the end, you actually decide who's going to do what to move the work forward. Um, and I think that's fairly unique in a lot of engagement methods. A lot of engagement methods is we're going to come up with some ideas, and we made this thing, but who's going to do the work? This actually provides an opportunity for people that you engage to commit to what their next step is and where they want to be involved.
Great. Thanks for adding that in. I was hoping you would chime in, so having just used it.
I
Yes.
also saw Taryn's hand pop up. Do you want to ask a question?
Yeah. And Matt, if you did end up touching on this and I just missed it, please feel free to let me know. Um, I one of the things that I think I run into a lot is and I saw it on the slide where you mentioned like representatives of a community. And I
Hmm.
find that sometimes, me as a queer researcher gets pulled into things to be like a representation or someone with a lens from the queer perspective on this project or facilitating this group. And I think what I don't always see is that people who are not a part of the underserved populations that they're working with in this community-based research, is there, have you experienced or is there any encouragement for cultural competency, self-education, reinforcement of like, it is not the community's responsibility to educate you, it's your responsibility to educate yourself on the communities you plan to be working.
Hmm. I think, and again, I'm very happy as we're having this conversation for others to chime in and dialogue too. If I don't even answer your entire question, I think there are a couple parts to your question. One place where I thought you were going was this notion. It should be a question whether we think when we engage people whether they're representative at all. And one of the issues of one of the reasons why I think the political theory approach is powerful is it does remind us at the very least that just because someone looks like someone doesn't mean that they are a representative of that community. That's the power of the other three parts of that, because it's saying, well, there are these other aspects of legitimacy. Were they chosen by the community? Do they actually advance the community? Right? Um, and so on. So that's actually a first question that in some ways I skipped over. Again, others can chime in. I do think that whether it's community engaged research or CBPR, both have a strong emphasis on the ethical obligation of researchers to understand community cultural context. Do they go the step of saying it's not the responsibility of the community to provide it, which is a different part of your question? Don't know how far they go in that regard. But they certainly acknowledge that researchers have that ethical obligation. Again, others on the forum here can feel free to chime in and add to that or the other question.
I think also too, like I know that we have within the work that I'm doing within DFM, like I know we have groups that like our focus is to get people to those educational resources, but I'm wondering if anybody has that experience, like when you're actually doing a community engaged research project, like is there a time to spend in saying, hey, this is our expectation of you, this is what we want you to understand, here's the resources where you can educate yourself. Like, has that
Mm.
been something that people have done before?
Yeah, I'll turn that to the wisdom of the crowd and with Sarah, Don, I mean, others, Lorenzo here that I see, Antonio, like all may have had experiences in this regard.
Yeah, I would argue that CBPR in particular has a principle around co-learning and bidirectional learning. And I think it is often core to relationship building to create time and space to learn from each other. Um, and so that doesn't necessarily mean a responsibility for community to educate researchers per se, but it does mean that part of building those relationships is asking the questions of the people you are partnering with um, about their communities, but also about their individual experience, so that you are both building those relationships and building that understanding, and that understanding often can only go so far with outside resources, right? There has to be some back and forth in that relationship where you're learning about the people and their communities and the issues. Um, so I would say yes, and to maybe not responsibility, but it does involve some back and forth in within a relationship to really meet that principle of co-learning and relationship building. I don't know if anybody else wanted to jump in on that.
I would also chime in and say that based on my experience, I'm a community research liaison, and I work primarily in the urban Latino communities of Metro Denver. Even though I go into some of the communities, I look like them. I'm still a guest in that community. A really good example, I was doing some
Mm.
focus groups, or wanted to do some focus groups in Via Park on in regards to uh, heart disease prevention. And but I wasn't familiar to them, even though I looked like them, I wasn't familiar to them. So what I
Mm.
did is let them share with me about what their experiences has been as far as research, what which wasn't very good in the past. But I allowed them that time to share and kind of vent what their experience had been. And I think that really helped establish trust with that community and taught me how to show up in that community. And long story short, even though they were resistant in the beginning, learning from each other, and I think why I earned their trust is that we shared a lot of lived experience that we shared with one
Mm.
another. So that really did help in nurturing a relationship, and they became kind of the lead in some of the work that I was doing. So, and it took some time, but it was that sharing of learned experience, lived experience, and also the cultural piece too was
Mm.
also very helpful.
Mhm.
Lorenzo. I'm gonna just put a call out. Jen just put our evaluation link in the chat, and we'd love to hear from any of you, especially if you're hopping off a couple minutes early. Go ahead and click that link and have it open. And then I'll go to Antonio and the question you might have.
Yeah, I think I live in a rural, very rural area in Colorado, southern Colorado, San Luis Valley. And I've been a member of a community advisory board here in the valley for probably the last 20 years. And and I wasn't familiar with research until I got involved with this group. And it was important for the community to get to know the researchers that were coming down here to observe situations, problems,
Mm.
and whatever to research the goals that were being brought into the research process. And what I learned is the communication that took place. We would have community advisory board meetings every month, and we would meet with the researchers, we would meet with the university, and they got to know us, and we got to know them, and a trust became very prevalent in our relationship. So the trust factor is really important, and as a community were very aware of what we wanted people to be aware of in our community. So it's
Hmm.
important that they didn't take advantage of us. It was interrelational. We worked together and we tried to come up with, because the goal was to try to help the situation here, to help whatever might be the problem, and that really worked well for us.
Yeah, thanks for that, Antonio. And I think as you were talking, I found myself thinking back to our focus groups with 6 different communities. And one thing I would say is that we observed that the features of engagement methods that built trust were not always the same between communities. Like some of our community partners in the Cheer project were looking for specific things in methods to help them know that trust was evident, oftentimes because of maybe like you were hinting at their prior experience, right? History. And when they've been treated in certain ways by certain people, then features of methods that remedy that look a whole lot more important to them than others. And so I think just to highlight and expand on your point too.
Think we've covered part of this question in the chat, and maybe it's framed a little bit more as a discussion starter. But I just wanted to see if Matt, you had anything else to add, if I read this. So also thinking about how do those in the engagement, the who know the community, meaning how do they know, how much do they know about the community's wishes? Is the community organized enough to have coalesced and shared their interests? And then Julie said, such an interesting and great presentation. Thank you.
Well, thanks for the positive comment. I think for the questions that are asked and the other comment are really important questions that just we should be asking. I didn't share the details of that Patient Family Advisory Council study, but that was a national level study of a program that was in Medicare. And, one of the first questions the people, when we got them together on the table, were like, we're all on Medicare. So what? Does that make us a community? I don't know. Like, what does it mean to be just because we all happen to have the same healthcare insurance? That's not community to me. So kind of even a bigger question, I think that tacks on to what was in the chat there, that all of those questions are so important. And what's really interesting is that in that study and in others, I of course find, not surprisingly, that people that we engage are often very well aware of those questions. And sometimes the first to tell us that they can't represent all of it. And those are really important insights on that who question.
Yeah, I'll just jump in here. This is Don. I think somewhere in that CDC principles book, it talks about the fact that communities are self-defining,
Hmm.
and
And
sounds like
diverse. Hmm.
sounds like Matt, that that community was defined by Medicaid or
Uh-huh.
Medicare, um, and so yeah, that's always an interesting point.
I know we're getting close to time, and I think one thing that I think about for the future, a future hope I have for researchers, and maybe this will help researchers too, is that I really hope to see, and I think that in applications and in research proposals, adding novel twists, novel engagement methods can be a great way to add innovation to a proposal. I long for the day when I'm reviewing grant applications or research proposals, and it's not just a stakeholder advisory panel, important though they are. I've used them. I'm using them in a research project right now. I have one, but still hoping that one day that approach and that innovative thinking about research methods comes to engagement methods. And we start seeing proposals that are comparing methods against each other or trying new things and helping researchers get research done and get it funded in a difficult funding environment through additional innovation and significance points.
All right. Don, well, first, Matt, thank you so much for a really engaging conversation and a really informative presentation. I really appreciate what you shared here today. Um, so thank you. And I see lots of nodding and thank yous from
Thanks.
others as well. And then Don, I'll hand over to you for our final wrap up.
All right. Thanks, Sarah. And thanks again to Matt for a really stimulating presentation. A lot to think about there. And appreciate everybody that threw out such great questions. Um, just a reminder that we are really interested in having folks both complete our feedback form, but if this is your first time here, make sure you register for the other forums in our series. These happen quarterly, and I know that summertime can be a little bit slower, but uh, as we get into the fall and winter season, make sure that these are on your calendar so that you can join us for the upcoming presentations. Um, and with that, I will close this out and we look forward to seeing you back in the next quarter.
Thank you all.